had the opportunity of being selected to serve in the 1st SEAL team.
It all started when my brother George came back from Vietnam. I was so proud of him, I told him I wanted to join the service.
Proudest moment of my life was working for the Air Force.
We have freedom in our country because of the veterans willing to risk their life and limb for us.
Thank you for the service you've provided to our people and our nation.
The population of Alaska is around 600,000 people, and of that number, about 77,000 are veterans.
The veterans in Alaska, being so spread out, they don't realize what a support system the VA is. On this island, we've got a lot of Vietnam vets. A lot of them fought the VA, say, 20 years ago. Well, it's not the same VA.
Every single veteran is important to us. We want to know who they are. We want them to enroll so that we can begin to serve them and to better coordinate their health care needs. And that's what the VA is all about. Once a veteran's enrolled and termed to be eligible for health care, the VA offers the full continuum of health care benefits.
The benefits I've gotten from the VA have been annual physicals for a while, and then just recently having an eye tumor and getting medevac to Seattle to get specialized care, and then not having to worry about how much that's going to cost, and am I going to lose a house over it, or am I going to have to work for the rest of my life?
I was at the point where I did not go hunting, fishing, walking. And with the VA healthcare, I started getting better and better and better.
We have an Indian Health Service funded clinic here in Metlakatla. So with our staff of medical doctors and nurses, we can receive the care right here.
Our partnership with the Native system is absolutely critical, essential to have in order to provide that health care to those veterans that live in those remote communities where the Native system is the only health care available.
The veterans won't have to travel so far away from home. They could use the facilities that we have in our regions. And the VA's funding will support their health care in those facilities.
I served in the military for 20 years, and I know what it means to serve. And then in turn, the government gives you benefits. This is the VA. If you wear the uniform, you're done with the uniform, let's see what we can provide you.
I enrolled in the VA just before I was going to retire because I didn't want to have a break in the service. For the guys that have been out 20, 30 years, 40 years, it's never too late to get back in the system.
I try to encourage all of them, man or woman, when they come out of the military to sign up with the VA.
If they can just go online, call us, complete the form themselves at home and send it to us, that's it. That's how simple this process is.
We've trained folks we call tribal veteran representatives who live throughout the state of Alaska, mostly in highly rural areas and mostly veterans.
I got the training and I am able to help other vets get in the system by filling out the 1010 EZ. It's 2 pieces of paper.
Honorable.
Yes.
It makes my day when I could have even one veteran come up to me and say, thank you.
It's all about the relationship and building trust. And that really comes from the VA reaching out and meeting the individual needs of a veteran.
I need to encourage you, all of you veterans, to please enroll for those benefits that you're entitled to.
There's enough benefits out there with the Veterans Administration for all of the veterans.
Every single veteran counts. Individually, one by one, we feel we're successful if we can reach out and touch one veteran to improve their life and get them their health care benefits.
I served 24 years, 8 years active, and then the rest was reserve, and I loved my job.
The pride that I got from being accepted into the military, it was like I finally made something, I could do something.
Because of the lifestyle that I enjoyed and served in with the SEAL team, we kind of beat up our bodies physically.
Approximately 80% of our veterans have served during a time of war. They're surviving disabilities that would have, in previous war, resulted in death. Veterans who have incurred an injury while in service are eligible for a disability compensation. That's a monthly compensation that they receive to help to make up for their lacking earning potential. There's also a non-service connected pension program. Depending on the level of disability, veterans can receive somewhere from a couple $100 to a couple $1,000.
It doesn't have to be, getting shot with an IED that makes you go to the VA and get follow-up care. My injuries were just repetitive movement.
Both my shoulders were dislocated through the military. My hips got displaced 3-4 times.
Presently 100% disabled, meaning that I can't go hold down a physical job anymore.
The disability benefits that I received from the VA just take a gigantic load off.
It gives me the opportunity of being the provider for my family.
The veterans don't have a timeline for when they can file for disability benefits, so they can come to us at any point. And sometimes disabilities become worsened through age, and they can also cause other disabilities.
If my eyes go bad, the VA takes care of that. They give me new glasses. Hearing goes bad, VA sends me to audiologists to get new hearing aids.
I think these benefits offer them an opportunity to gain that sense of accomplishment after their service. They also come to the Veterans Benefit Administration looking for further education. The education can help to augment some of their training they had in the military or to help them become more employable. We also have a home loan guarantee program.
There are just so many opportunities available today that if the young veteran would stop and think that these other services are available besides the medical needs, then sure, we'd get them all signed up in a minute.
Veterans can come into our office and we can talk to them directly. Veterans can also log onto our website, va.gov. We have a program that's called eBenefits. It allows the veterans to file applications right online, check the status of their claim through that. They can call our national call centers, and also they can participate in various outreaches that we do throughout the state.
It doesn't matter if you are an EOD person versus a medic versus the supply guy versus the cook. Fill out the forms and go and get what you're entitled to.
And the VA makes sure that we're well taken care of.
We do want to make this as easy as we can. Ultimately, the goal is to process these claims timely and accurately and to give the benefits to the veterans that they deserve.
National cemeteries are beautiful national shrines. We look at it as a resting place among comrades, among the people that they served with. We look at it as a resting place of heroes.
It helps the family realize that their veteran who has passed away is honored.
It's just a way of dignifying an individual for the sacrifice they made for their country.
They served our country, and they need to know what comes with that service. What we like to say for the National Cemetery is everything within the cemetery gates is free of charge. Those burial benefits that we give to the family is what they earned because they went and they fought and they served to give us the freedom that we enjoy today. We have veterans here in Alaska that live everywhere, and we want the veterans in the rural communities to be aware of the benefits that they have coming to them and how to apply and how to make it easier to get them.
If a veteran passes away, for instance, in Metlakatla, the VA will pay for the headstone or a plaque, depending on what the family would like to receive. And we help them fill out the paperwork, and the VA will pay for putting that headstone together. They pay the transportation to Metlakatla, and we just help the families put them in place.
Of course, they would still get the honor ceremony and the flag and the Presidential Memorial Certificate, but the only thing that the veteran would have in a private cemetery is the marker or headstone.
For me, it's a headstone for my father, and I did not know he qualified as a Alaska Territorial Guard to get a headstone. So he has a granite headstone.
We have villages all over. We just did a rural outreach in Cake where we went down and set markers of our veterans who served there, who were rested in unmarked graves for years because they didn't know how to get the headstones that they had earned. And it was so rewarding.
Often, a lot of people didn't know that they were vets. The flags and the headstones are a symbol to the community of the honor, the integrity of that person.
I'm a VA employee. I'm also a veteran. I know the benefits that I've earned, and I want the knowledge to be passed on to all the other veterans. It's good for the veterans to know that if they wish to be cremated and scattered at their favorite fishing hole or in their garden out back that they've tended so lovingly, their burial benefits can be used for their eligible spouse and their children. We want to make sure that the veterans, even in the farthest reaches of Alaska, when they pass their service to our country, we want to make sure that that is honored and that they get every benefit that they have earned.